Dr. Bina Dagam from Port Moresby General Hospital said many women only find out they have cancer when it reaches stage 3 or 4. She said at that point treatment becomes harder and the chances of recovery are low.
The number of women who have gone in for surgery for breast cancers, they're all presenting at a stage 3 or stage 4, which is a later stage. Over the last 5 years, we've only seen one who's presented with a stage 2 cancer. So we know that these women are coming in very late. You know, when you get a cancer, you start putting it's like a clock, starts ticking down on your life. So the earlier you present, you can be cured, or the longer you can live. The later you present, just know that the chances of the cancer spreading and you passing away sooner is much higher.
Dr. Dagam explained that many women develop early signs of cancer but ignore until the illness gets worse. Also, local clinics keep patients on antibiotics instead of referring them for screening and proper treatment.
If you attend to someone and you know that this person has something wrong with the breast, please don't repeatedly treat with medication. If you see something which has been there for, say, more than 1 month, 2 months, that's not normal. Have them sent off immediately. I have come across women who have just repeatedly been given antibiotics. The longest period I've seen has been for about 3 years.
Dr. Bolo Watota, Chief Physician at the National Department of Health, called for more awareness. He said large population live in rural areas.
Here in Port Moresby is not the bulk of the population. The bulk of the population is in the rural and primary. So we have to focus on primary areas in terms of interventions. And then primary will, while we have established services in the cancer unit and the cancer division at the hospital, whether it's surgical, pediatric, or internal medicine, how many of our population that are diagnosed with cancer reach them? You know, many of them, they cannot, even the results do not come back in time for our colleague doctors in the periphery. So that exposure to that system, it has to build up properly, and that exposure, whether patients are diagnosed, whether they are at risk, there have to be a pathway that leads them to that exposure into that system. So
Dr. Watota called for more awareness in communities, proper record and early referral to help patients get the care they need. Mimi Pio, National EMTV News.